Hello, welcome to we believe is episode 6 of Vulva Talk. I'm Dr. Margaret Cox, a dermatologist at the
And I'm
University of Utah.
and I'm Kylie Moss, OBGYN at the Centers for Vaginal Disorders in Washington, D.C.
Yeah, summers are tough, huh? I feel like.
Yeah. Listen,
Anyway, we had thought about what this episode would be about and thought a good topic would be the external anatomy of the vulva.
indeed.
Is is
And
that right?
yes. And I feel like it's a very nice, like the three topics that we're going to talk about all like flow together really well. Starting with an artist that's in the UK that has been traveling around in a giant vulva costume. And it's been getting a lot of attention because there is a sculpture in the British Museum. There are these, I think they're Irish sculptures that have exaggerated vulvar anatomy. And they're features on very old buildings considered sacred in some cultures. And one of them is on display in the British Museum. So there's an artist who is wearing an enormous costume dressed as a vulva to bring awareness to the fact that she would like this sculpture to be repatriated to Ireland. So did you see the costume?
Yeah, I love it. I mean, so it's like a big pink fabric. I think those were the labia minora. And then there's this like blue clitoral hood. That's what it looks
Yes,
like,
the
right?
hood is what really makes me happy because like the
Yeah,
head is the clitoris, which it's like
yeah,
a great analogy.
yeah. So I find these little sculptures fascinating because it's primitive little person. I'm assuming it's a woman because they're holding open their vulva.
Yeah.
And they used to be on churches in Ireland and go back to the 11th century. And we don't fully understand what their actual message was. There's different theories as to what they represented. So some theories suggest that this was a way of protecting people from sin. So kind of lust and sexual sin, I guess, being among those. And the other thought is that these figures with these large gaping vulvas would ward away evil as well. And then I think now more recently people are starting to think that they are some kind of powerful fertility symbol, or
Yeah.
at least
I mean,
or
they
at
all
least it's
seem
being
like
like adopted as that.
yeah. I mean, they all seem like reasonable explanations and it's impossible to know.
Yeah.
I think that I've been to the British Museum. It's really an incredible place, but I also appreciate that there are a lot of artifacts there that probably need to return to the areas from whence they came. And I also feel like I want this piece of beautiful vulvar art that's being embraced by its homeland to get to go home. That doesn't seem right to me at all. And I appreciate this person. I think the artist's name is Growler.
Yeah. Apparently that's like a would it be like a
Slang term.
colloquialism for vulva
Yeah.
in Ireland?
Yes. I mean, maybe we should start using it as a hashtag on Instagram because it will fly under the radar in the US for sexual
Hashtag
medicine.
growler.
Yeah,
That's
growler.
awesome.
Yeah. People think we're talking about beer.
Because the official name for this sculpture is, what are they calling it? Sheila Nagigs? Sheila
I'm
Nagigs.
impressed with your I did not look up the pronunciation. I wasn't even
Sheila.
going to try.
I don't
I'm
know what
just
the
going to put it as a
pronunciation
little
is.
yeah.
I'm probably butchering it. But I mean, Sheila is kind of like a slang for girl or woman, at least when I think about Australia. I mean, and
Yeah.
apparently it is in Ireland as well.
Yeah.
And there's a pretty big movement. I mean, I had looked at an article that came out about 4 years ago in the Guardian, and it had a great title. It was called "Big Vagina Energy." I mean, it should have been vulva, but okay, I'll take it. The return of the Sheila Nagig.
Yeah.
And there have been a lot of sort of movements inspired by this sculpture to empower females and
Yeah.
sexuality. So it's kind of an interesting phenomenon.
Dee Mulrooney is the name of the artist, but this is her sort of alter ego of Growler. And she said that even if Sheila Nagig gets returned, Growler will not go away. Be used to draw attention to other causes, which I think is incredible. I think it's really, really heartening to see such a positive imagery and used for a good cause.
Absolutely.
We also wanted to talk about some articles that deal with vulvar anatomy and a couple of resources. So, do you want to dive in with articles?
Sure. So, I mean, I get asked this question a lot in my clinic when I'm seeing my vulvar dermatology patients. And really, the question is, what does the normal vulva look like? And I think, unfortunately, unlike male genitalia, which apparently has been studied and measured and categorized and standardized for like hundreds of years, this is a relatively new phenomenon. And there's not a ton of research that has actually focused on quantifying what a normal vulva looks like. But there have been a few papers that have tried to capture what a normal vulva looks like. And I had a look at a few of these papers, and I think the overarching conclusion is that there is no normal anatomy. Really, there is no standard normal. There's a huge variation in the length of the labia minora, the width of the labia minora, the length of the clitoris, the width of the clitoris, and all the studies we have suggest that we can't really use one number to say once you go above this number, you have a larger than normal vulva, especially when it comes to labia minora. A lot of these papers specifically are addressing the rising trend in labiaplasty or like labial reduction, and how there have been these numbers put out in the literature suggesting that if your labia minora is greater than 4 centimeters, that's greater than normal, and that makes you a candidate for a labial reduction. There's other papers that say that number should be 5 centimeters, and they're not really papers that are based on kind of large numbers of people that have had their labia measured and quantified and cataloged. And I think that's the overarching conclusion that I take from reviewing these these papers, and a lot of them are not looking at huge numbers of people either. I mean, the one that had the most number of people, I think, was they had 50 female genitalia that they looked at, and interestingly, though they were all white vulvas, there were no people of color in this paper, and that's obviously a huge limitation as well in terms of generalizing to the population. But that's kind of all we got. There have been some newer models, Kylie, that you looked at.
Yeah. So, one of them is in a book chapter, and it was tough because I could see the abstract of the chapter and some of the images related to the research that these folks did. But what I wasn't able to get, I actually messaged the authors to try to get the full article so that I could really see what the biases are, because it's a big sample relative to the other papers we could find. They looked at 1,300, over 1,300 vulvar images, and they used them to make a 3D printed model as a resource for normal vulvar anatomy. And I think that's amazing. It's geared towards adolescents. The pictures I could see look like a very reasonable representation of anatomy. And they sort of are showing average anatomy based on all these images. Tricky thing is, without the full resource, I can't say that they used a super diverse sample. And looking at the images, I would say, you have to start from somewhere, but it would have been nice to have retracted images in addition to images at rest, because the labia are dynamic and you can't appreciate the vulvar vestibule or the hymenal remnant, the ring of the hymen, very well if you don't have the labia minora retracted. So that's the only thing. Yeah.
The point of this, what is the point of this 3D model?
I think it's I mean, the beauty of 3D printable resources is that someone can print it anywhere if they have a 3D printer, and show sort of average representation of anatomy and use it as an instructional model for adolescents so they know the parts of the vulva.
Yeah, I mean, one of these papers mentioned, this was a paper that was looking at adolescent female genitalia, and they had mentioned that there were scores, I think it was like 244 labiaplasties performed in patients under the age of 14, which I find kind of shocking.
It's
And a
really
lot of these
shocking.
yeah, a lot of these young people are coming in kind of thinking their vulvas are not normal because they've seen pictures on social media somewhere. So
Yeah, and
I
you
feel
talked
like in
about
this context, you
before
know,
that there could be
yeah,
pornographic influences that
right.
are making people think that their anatomy should look more like anatomy that's probably altered. There's a website called hormonally.org that just came out with an interactive guide to vulvar anatomy that I think is like a good representation. And it's certainly very like a reasonable thing for people of all ages to look at. And I also love that they have the anatomy of the clitoris, the pelvic floor, and the pelvic floor muscles. But the vulva map is a lovely interactive resource where you can sort of hover over different parts of the anatomy and figure out what the name is. So that's good.
Yeah, that's a great website. What always blows my mind is the anatomical diagram of the clitoris, because it's like the part that we kind of think about is just the
Gross.
little clitoral nubbin, but there's so much that is happening beneath the surface. So every time I see that an anatomical drawing of what lies beneath, I'm always like, wow, that's incredible. I feel like that's kind of a life-changing visual when you look at it.
It is. It is. The model that I made, which I always wish I had one at home and I have to make one at home. I'll show it in the clinic and then pull the clitoris out and show that it like is just as big as it extends to the length of the labia, and people are shocked.
Yeah, I
Yeah.
bet. I
Yeah.
bet they are. I mean, I feel like that is quite a shocking
Yeah.
one. I think
Yeah.
I
In
think the
terms of
other
Oh yeah, go ahead.
oh, I mean, I think the only other thing I want to mention was so it's one thing that like yeah, the average person out there isn't really we don't really know what the average vulva looks like, and I think that goes to that is also true of physicians or healthcare providers when they're looking at vulvas. And one of the takeaways from one of these papers was that there's a lot of assumptions that even if you're say you're having a labiaplasty, that the surgeon who's doing it, that they know what a normal vulva looks like, and that is just simply not true. And I just wanted to kind of highlight that, because I
Because no
think
one can really know because the studies have not been done
right, right,
longitudinally.
and the studies that have been done show us that there's so much variation in every single measurement and aspect that there is no like gold standard measurement that we should be comparing ourselves to. So going into a cosmetic surgeon and being like, this is like the perfect vulva, like that's just not a thing. And
Because
if yeah,
your pelvic floor muscles, your pubic ramus, the bony part of your pelvis, those are all unique to you. So knowing what is going to be functionally appropriate in terms of the labia in that setting, it's only what is comfortable to
exactly,
you and sexually
absolutely,
functional. And I think that I've seen people who have really prominent labia minora. They're, mature in their understanding of the anatomy and its potential function. And it is really impairing because every time they walk, their labia minora rub and bother them. And for that reason, they want a labiaplasty. And I think if you see a surgeon that understands the anatomy, understands safe ways to reduce the labia,
absolutely.
then that's reasonable. But there are
I
two,
agree.
sort of reputable ways to do labiaplasty. I personally don't do them unless someone has profound functional impairment. But I've seen the fallout from really unfortunate ones and,
Exactly. Like you mean
profoundly.
surgical fallout of an
Yes. Yes. People who go abroad
oh
to have
wow.
these procedures done and don't know what they're getting into, and the person there doesn't know what they're doing, and they have clitoral nerve injury or pudendal nerve injury that causes them long-term functional impairment. It's really not a minor undertaking, even though it seems like they're just these little flaps of tissue. They have functional, um, you know, purpose, and they have proximity to really, really important nerves.
Yeah. And I think that's the other takeaway here, that, there definitely is the potential for functional impairment with large labia minora. I mean, that's what I kind of hear about the most. And I feel like if there is that functional limitation, then doing that kind of procedure is totally reasonable. But if it's just kind of cosmetic, I kind of wonder, if the risk benefit is worth it, because there are a number of risks that can occur from this kind of a surgery.
Yeah, I mean, you're putting a stitch in to close your incision and you lasso a aberrant nerve, a nerve that we can't predict is there, can have really long-term impacts on sexual function. So it's just something that really needs to be undertaken with a great deal of caution.
I mean, I guess that's sort of what we were talking about in terms of what patients or people out there in the wider world are concerned about asymmetrical labia. That's a
Yeah.
question I kind of get a lot of. So if one of your labia minora are larger than the other labia minora, what does that mean? Is that normal?
Yeah, and I think it's all I mean, nobody's symmetric, right? Nobody's face is perfectly symmetric, nobody's body is perfectly symmetric. Our heart is on one side, different lobe of the lung on the other side. I think, my guess is that that's related to many things, including differences in blood supply and just the same things that cause differences in symmetry in the rest of our body also affect the labia. Um, and I've never seen someone with perfectly symmetric labia. I guess you can weigh in, but I've never seen
Yeah,
perfectly
I have
symmetric
not.
labia.
I mean, the other kind of question that I get a lot of, and there's not a lot of data on this either, and I see a lot of it in my clinic too, is the coloration of the vulva is often different than surrounding skin. So usually it appears darker than surrounding skin, and I have noticed a lot of hyperpigmentation, for example, on the labia, the
Yeah,
edges of the labia
distal.
minora.
Yeah,
And
that
there's
margin.
also textural changes that are apparent there on that labia minora. So in some people, it wouldn't be like canified, but like there's more kind of rugae and kind of not
A
rugae,
texture.
kind of like
Yeah.
texture. So I kind of get asked a lot about that, and usually I say, that is normal. Sometimes I think
Yeah.
about whether hyperpigmentation, so we see a lot of post-inflammatory hyperpigmentation in skin, and the vulva is no
Yes.
exception.
Yes. And when you say like inflammatory hyperpigmentation, I'm assuming what you're seeing is sort of more splotchy or patchy brown pigment, not as even and symmetric. And so when you see that, then that's a signifier of a potential inflammatory skin condition that may have resolved because the body, as it heals, it will put down more pigment and it will do it unevenly. So you'll have darker areas of skin. Does that match with what you've seen?
Yeah, yeah, totally. And I feel like there's a lot of kind of different things that go into whether I think something is just kind of background, baseline, pigmentary change and post-inflammatory change. The one paper that going back to one of these papers I looked at did actually document or keep track of the color of the genital area compared with surrounding skin. They're not very specific about what part of the genital area they were looking at. I mean, I tried to figure that out, but they kind of just left it at I mean, I don't know what exactly they were looking at, but out of the 50 patients they looked at, only 9 of these patients had the same color of genitals as their surrounding skin, and 41 appeared darker than surrounding skin. So
Yeah.
this hyperpigmentation in the genital skin seems to be more common than the skin appearing the same color. They also tracked this is where I got this rugosity from. They called it
Yes.
rugosity of labia.
Yeah.
And
Okay.
again, of those 50
Little
patients,
bumpiness.
14 had smooth labia. Yeah, 14 had smooth labia. 34 had moderate rugosity, and 2 had marked rugosity. So again,
Okay.
textural change
Texture.
also very common. So pigment change, textural change, very common in the labia minora. As we talked about, it seems like nobody cares about the labia majora.
No, I know. And the hormonally, I really love the diagram, but I was like, I feel like the labia majora got a little shortchanged. They provide padding. I think they prevent pudendal neuralgia.
They do track the labia majora length in this patient population. So they did look at the length of the labia majora in this little paper, and they also looked at the labia majora length in the other paper that I looked at.
What I'm curious about, because I see pigmentation differences all the time, one of the things I find that people, especially if they have LS or they have other known vulvar skin conditions like implantus, is even if their symptoms are in pretty good control, if they have a little redness, that can be really upsetting to patients. And sometimes they have redness without symptoms. Sometimes I think it's evidence of we need to dial back the steroids a little bit.
Totally, yeah,
But sometimes they're living
yeah,
their
and
lives,
I
it's been
think
stable, And I say, like I'm not that worried about it, but I'm
Yeah, I think redness is a little, less clear, and there's a lot of contextual things going on. We talk a lot about the vulva being a modified mucous membrane and how steroid side effects are less frequent in this area. I mean, a lot of the papers I looked at, I remember looking at one paper where they looked at this huge cohort of people and like 1% of them had steroid side effects, but I feel like that redness and that telangiectasia I see quite a bit with long-term steroids. And again, if it's like asymptomatic, I do usually recommend dialing back on the steroids at least to see if that will cause a change in the way the skin looks, but I don't find it too worrisome unless there's impending worse outcomes with topical steroids. And I typically don't see that unless patients are using them in like the inguinal folds. And I have seen some horrific steroid side effects in inguinal folds where you're using a super potent steroid like clobetasol inappropriately. And when you put it in an occlusive area like that where the skin is inherently thinner than in other parts of the body, that you can have some horrible side effects. I don't see those horrible side effects as much in the vulva, but I do definitely see some redness occasionally.
Yeah, I've seen someone who had Cushingoid changes. So she had like striae, the stretch marks, and then changes in her adrenal function. So we had to sort of slowly um, improve things for her.
What were they? Were they on like clobetasol?
Yeah, it was topical clobetasol, but slathered. It wasn't,
How did
appropriately
you
instructed.
so did you do labs for the adrenal
I
suppression?
did. Well, she was reporting a lot of systemic symptoms, and then I had to send her to endocrine and say, like this may be from, and that can take 6 months to improve because it isn't like that amount of really potent steroid administration goes away. But I hesitate to talk a lot about that because it is so far outside the norm of most people's steroid use experience. And
Absolutely.
she
I
was
mean,
using
I haven't
huge
had
amounts.
anybody have that. And when I was recently putting someone on intravaginal steroids for lichen planus, I was kind of trying to figure out what my dosage would be. And from what I was looking at, you could probably use like 50 grams of the topical steroid before getting adrenal suppression. You
And a normal
probably would
tube is
have
60 grams, so that's most of a tube.
over a week, so over a week
Yes,
dose.
yeah.
That was kind of like the benchmark that I was using. I mean, I was giving her a lot less than that, but I was like, there's no way I've ever given anybody that much topical
No,
steroids.
I've looked at the same references, or they will say like an inch from the tube daily. More than that is going to get you into trouble systemically, but you have to use a lot.
Yeah. I mean, that I like to just give like compounded suppositories, but of course, um, there's an insurance issue and there's like a cost issue, so we were trying to figure out something that was more cost effective. But anyway, yeah, the adrenal suppression, I know that it can definitely happen with topical steroids, but personally, I haven't seen it happen.
One time,
But I have
yeah.
you've seen it one time. There was one patient where we were wondering whether topical steroids were somehow influencing her hemoglobin A1C, but that's not.
Yeah. Well, and this patient did have some A1C effects, but again, huge.
So I've kind of seen that, but more often than not, I don't see anything. Sometimes I see a little bit of redness, and the redness can be from other things that are happening in that body as well, but that part of the body.
Right. And I mean, it's also just like proximity of blood vessels to the skin. I think sometimes the skin does look a little more red. Yeah.
Yeah, I think physiological redness is a real thing in vulvar
And
tissue.
post friction redness, like I'll have people say, well, now every time I have intercourse, everything looks really red. And I'll say, well, before you had symptoms, were you looking after intercourse to see what things look like? Because it's a thin area of skin that I think the blood vessels dilating during sexual activity and combined with friction can cause redness. And I'm not so worried about postcoital redness if it doesn't match symptom modulation, how symptoms go up and down. Yeah. And that's the thing is the problem we have is like baseline. we don't look
The problem we
until there's a
have is
problem.
baseline. Yeah, I
Yeah,
mean,
we don't look until there's a problem, so we don't have a good
we don't look
assessment of
until
what
there's a
normal
problem.
is. Yep.
Yeah, and of course, like all the patients who are, I mean, the patient populations for these studies were, I thought they were pretty reasonable. Like
Yeah.
the people that they were measuring. I mean, these were people who were coming in for something totally unrelated. They had not had any surgery on the skin previously. So,
Right.
the thought was to get a fairly representative population of quote unquote normal vulvas, which I think is also important to consider.
Yeah. I really need to
But
get
we
that
still have a
chapter
lot of
because
work.
how do they
Again,
get
this is a,
1,300 normal vulva
I don't know.
pictures?
Yeah, how do they get 1,300? And adolescents, right? I mean, I don't know how they did
Yeah.
that. Because I feel like
Yeah.
younger people generally are a little less gung-ho about having their
Genitals
genitals looked
photo
at.
in certain contexts.
Yeah. Yeah.
Yeah. All right.
Well, we had some technical difficulties during this episode, but we got
Yes.
through.
We got
Hope-
through
I think.
it. And
We
that's
think.
a wrap. Yes, I think. I know. I hope it's okay.
I hope
Yes.
it's okay.
All right. I feel like we should do a lichen planus episode.
Do a lichen planus episode.
I feel like the next episode.
Yeah, let's
should
do
be
a lichen planus episode.
focus. Yeah.
Let's do it. Fun times.
All right. So you heard first.
So you can follow us on the socials. Dr.Cox on Instagram or Dr. Vulvarderm on TikTok.
And I am Dr. Kylie Moss, ChaileeMoss on Instagram, also on Reddit and YouTube.
Also on Reddit and YouTube.
And we shall see you in a month, I guess,
All
right?
Yeah, sounds good. August.
Yeah,
Okay. Have a good one.
August. Okay, have a good one.
Yeah, I don't think we're going to be able to do it any more frequently than that.
9